Hello, this is Dr. Neil Baum from New Orleans, Louisiana, and I would like to spend about 7 minutes talking to you about telephone techniques that will endear yourself to new patients. In the past, I have tried to provide new techniques and new technology that will enhance the productivity and the efficiency of your practice. For this video, I want to go back to basics. And I'm reminded of Coach John Wooden, UCLA, a 10 times NCAA champion coach, who gave a lecture on his first practice of every year on the importance of how to properly tie the athlete's shoes. I'd like to use that same metaphor on something as simple yet important as learning proper telephone etiquette and technique. This program will cover why is the telephone important and a few suggestions for enhancing the patient's experience when they call your office on the telephone. The telephone is important because oftentimes it's the first interaction that the patient has with your practice. It's your opportunity to create a good first impression. The phone should be answered in a consistent fashion. This is name of the practice. This is the receptionist, and she should state her name, his or her name, and offer to be of assistance. Make sure everyone is trained and has the same telephone technique and uses a similar greeting every time the phone is answered. Give top priority to new patients who are calling for an appointment. Give this your undivided attention, and there should be no multitasking when you're speaking to a new patient. Try to get that patient an appointment as soon as possible. Offer new patient choices. Ask them what day, give them several days or options, give them several times that they could come for an appointment, and also mention to them if you have this available, the opportunity to have a virtual visit. Confirm everything, the time of day, the date, also the directions to the practice, and also give them instructions regarding parking near your practice. I think it's important to discuss at the initial phone call the cost of the initial visit. Give them a ballpark of what they are going to spend on that first visit. Tell them about bringing all their insurance information, any previous lab tests and imaging results, a list of all of their medication, including over-the-counter medications and supplements, and if necessary or a requirement, a prior authorization for that first visit. You want to avoid gaps in your phone coverage, especially at lunchtime. Someone should be covering the telephone during the lunch hour so it does not go over to an answering machine. Avoid the voice mailbox, which only leads to patients not leaving a message, hanging up, and calling another office. The take-home message on phone trees is that trees are for fruit and acorns. They are not for your patients. Patients want to speak to a human voice. Do not make them go through a treasure hunt to find the proper person in the practice. Provide them with a human voice on each and every phone call. You want to provide good coverage after your office closes. There's a wonderful program called Yes Track, which I do not have any financial interest in, that you can create custom scripts for answering after hours. They can also have access to your schedule and book appointments, and can create emails and text messages after each call. The take-home message on the telephone is that the telephone is an opportunity to create a good first impression. That's why on my receiver and on every phone in the office is a sign, a label indicating that telephone is equal to an opportunity to create that good first impression. In summary, you want to train your staff with proper telephone techniques so the phone is answered consistently by anyone at any time that a patient calls the office. You want to have a priority to get new patients scheduled as soon as possible. Otherwise, they will call another office and get an appointment at somewhere else in the community. And you want to cover your phones with live people on every phone call and avoid the use of phone trees. I began with the advice on John Wooten on basics, and I'd like to end this video with John Wooten's advice, and that is the little things, such as how the telephone is answered, can make big things happen. I hope you found this video helpful and useful. If you have any comments regarding how the phone is answered in your practice and you would like to share them with our colleagues, please don't hesitate to contact me at the email address on this last slide. Thank you.